Hello, I'm Sana Khan and you're watching Medicircle. Today we have with us Professor Ashok Rattan. He is an advisor for Quality Research and Development Forum at PathKind Labs. Please welcome him to our show, Rendezvous on Patient Safety Series. Hi, Professor Ashok. How are you?
Hello, I'm fine.
Okay, to begin with, patient safety is a global health priority, hence proved by COVID. What are your thoughts on the same?
Patient safety has always been priority number one in the laboratory, and that is why they have this accreditation. And when PathKind started, our stated aim was to do the right thing right the first time, every time. And so we are going to be a pan India company. We have already 60 labs and about 1,000 collection centers. And we had decided that everything will be the first is infrastructure. So you make sure that the infrastructure is state of the art. The equipment are bought from reliable sources. They are all closed systems so that the reagents are bought centrally and then dispersed to the location. They are then working according to standard operating procedures, and the persons who are hired are trained and then monitored to look at their competence and ability to perform the tests. And then all our labs are enrolled in external quality assurance program besides doing quality control with every day. So that every step is being monitored. As you know, in the laboratory, you have three main areas. One is pre-analytical, analytical, and post-analytical. Pre-analytical is between the time of collection of sample and performing the test. This is the most variable because there are many persons involved, and the rest of the process in the laboratory, errors do not normally occur, partly because everything is very well controlled. It's the pre-analytical part which is most variable and most prone to errors. So we have developed a sample collection manual which we give. This is both in a written form, it's both in a printed form as well as a soft copy, which is given to everybody who deals with us, which describes what is the test that we do, what is the sample that needs to be collected, how it needs to be collected, what temperature should it be transported, and when would the result be available. So once you pay it, and of course, all the phlebos, the persons who collect the samples are normally known as phlebos. These phlebos are also given regular training. Uh, Compliance sometimes is a difficulty, and that puts patients at risk. But if once they understand that they need to follow the rules, and then in the lab we have rejection criteria. If the sample is not, see, one thing is that there must be two patient identifiers. If there are two independent patient identifiers, chances of missing or mislabeling becomes less. That is why we give barcodes, and the barcodes are placed on the sample as soon as the sample is collected. And also on the TRF, test requisition form. We do not accept a sample without test requisition form, and the test requisition form as well as the sample barcode must match. Then only it's accepted. If the sample is hemolyzed or it is turbid or it is lipemic, then again it can interfere with the results. So we make sure that we don't accept it like that. If it leaks, then again it can cause trouble. So those are rejected. Then in the lab, as I said, the environment is quality controlled, the humidity is taken care of, temperature is taken care of, and the persons are not in the laboratory. Normally we have a restriction of entry so that they are not disturbed and they can continue doing their work. And once the sample has been processed, then they don't have to write with hand. It is bidirectionally, our instruments are bidirectionally linked to our software so that it will populate the report at once. Then the doctor will, first the technician will review, then the doctor will review. And once that is done, we send both soft copies as well as hard copies. And as I said, all our laboratories take part in quality assurance programs, and we buy most of the quality assurance programs of the tests that we do. Some of our labs are accredited to NABL, that is ISO 15189. They have also started an entry level schemes. Our labs are of three types. One is the reference lab, which is the big lab, which is naturally NABL accredited. Then we have network labs, which are smaller labs. They'll do till hormones. And then there is rapid response labs. Our aim is that we should reach out to the patients and we should be in smaller districts and towns so that the common results can be reported within half an hour or so. Those are known as rapid response labs. And even those labs, we are getting accredited. So the aim is that we should not make any mistake, and we should monitor. Whenever mistakes occur, then the difference is that for patient safety, you need to understand that it's not a person who makes the mistake, it is the process which makes the mistake.
Right.
So we need to keep improving our process, and mistakes should be looked as opportunities for improvement. So we must, whenever something goes wrong, we would then try to do root cause analysis and then try to see that the system, the process is improved. Once the process improves, then hopefully mistakes will not occur. The same mistake will not occur again.
Right. Okay. Professor, the theme for this year's Patient Safety Day is Safe Health Workers, Safe Patients. What is your contribution towards the safety of the health workers?
See, health workers are also at very great risk because ultimately, if we are doing, say, between 2,000 to 5,000 tests of COVID every day, that means, and about 15 to 20% of them are positive. That would mean that we have much higher chances of being exposed to the virus. Any break in the process would cause trouble. So it starts with the training. We train the persons. Every person is trained. Then the infrastructure, we have biosafety hood. That would mean that those are biosafety hoods in which the temperature is controlled and the airflow is controlled, and only the packets which contain the sample are opened only in biosafety hood by persons who are wearing PPEs. They are protected completely, and they're wearing gloves, they're wearing apron, they're wearing a mask, they're wearing goggles, and then they would then keep it separately, and it will be processed in another biosafety hood so that the whole process till the virus is live is taken care in biosafety hood. Once the DNA or RNA is extracted, then the virus is dead. Now the risk becomes less. Now the sample might get bad. In our sweat, there are RNAs which can destroy the virus and give wrong report. So we need to make sure that the sample is also protected. Patients need to be protected. Healthcare workers, all our healthcare workers are vaccinated against hepatitis B. So when they join, we make sure that they undergo training. Then they also have a physical examination done, and vaccinations is given to them. Vaccination is available against hepatitis B, but healthcare workers are at increased risk of acquiring HIV, hepatitis B, and hepatitis C. Against hepatitis B, there is vaccination, so all our staff are vaccinated. And after 3 doses of vaccination, 1 month after that, we take their antibody, we take their blood to find out what is the level of antibodies, that have they produced sufficient antibodies for their protection. Again, tuberculosis is another disease which is acquired in the laboratories. So again, all the work. Tuberculosis lab is a negative pressure lab. It is a 2-room lab, so that from the corridor you have to come into a smaller room which is airlocked, and then only when you close the door can you open the second door, and that is under negative pressure, which has biosafety hood. As a consequence, all work will be done in biosafety hood, and no bacteria can go into the main lab. And biosafety hood has provision to burn the virus or bacteria as it goes out, so that the environment is also protected. And lastly, it is attention to biomedical waste. The biomedical waste that we produce, we autoclave, and then we send it out to the vendor, who would then hopefully dispose it of in the right way.
Okay.
So every step proactively we try to make sure that attention is given to every detail, so that chances of error doesn't occur.
This is a digital age, and healthcare is highly influenced by technology trends. How do you think this transformation will support patient safety today?
I think more and more digital. People are going in for digital, especially the youngsters are very data savvy. Some of our seniors are also data savvy, and we have been having a lot of video conferencing,
Right.
video consultation. Though the sample has to be physically collected. So what we've tried to do is we've done. One is home collection was always there. Though for home collection, then the person has to wear the PPE and then go into the home. The second option we have is a person can drive in. So we have made a drive-through where the person doesn't come out of his car, and our flabo goes and collects the sample from them. And then the report are always transmitted electronically. We also, once the report is ready, we send an SMS that the report is ready. Then we give them the password so that they can download the report if they want. But if they are not able to download it like that, then we send a PDF file onto their email. But we also provide hard copy to them. So we are making use of all the software that is available, and all our labs are linked, so that once the report is ready, then whether you are in Shamli or in Beirut, or whether it is in Varanasi or in Bengal or in Odisha, you'll have the report at once.
Okay. Thank you so much, Professor Ashok, for coming to our show and sharing your insights for our patient safety series at Medicircle. It was a pleasure having you here.
Pleasure is mine. Thank you.
Thank you so much, sir. Have a good day.
Stay safe. Thank you.